Good morning, everyone. I am hopefully going to get through this one. I've been trying to record this video now, I guess you could say a total of 3 times. I fully recorded it about a week ago, but it seems to be too large to upload, so we're going to try a abbreviated version. But then I've tried twice today, but my medicine and my care team had to come in, so I had to pause. So hopefully we'll get through this one. But anyway, yeah. So a little update on what's going on. I'm back in the hospital, and what that basically is, excuse me while I up periscope myself here. But basically what that's for, it's all planned, no scary surprises or anything like that. Just basically I am getting my final type of chemo on the first round, and because there can be some very serious side effects with it, I have to do so many days of observation where I am here in the hospital and I am trying to, or I'm basically just laying here getting my labs done every 12 hours, really less than that. Basically at both 1:30 a.m. and p.m. and 7:30 a.m. and p.m. they come in and take a little bit of blood from me to test what my levels are. I'm also, sorry, trying to adjust everything as I'm doing this. My blankets are all bunched up under me. Anyway, thanks for bearing with me, guys. Like I told you in the beginning, this is not going to be an edited thing, so you're going to get to see all the little discomforts that I get to deal with throughout the whole process. There we go. Yeah. So, yeah, basically, they've got me on a constant IV drip just because of the fact that the type of chemo that I had, which is called methotrexate, is a drug that it can actually affect your kidneys, and in worst case scenarios it can actually cause them to crystallize. Again, I'm pretty sure I've already said this, but there's a lot of prep that goes into this and then a lot of post work that happens with it. Basically, beforehand I have to do I have to take 3 sodium bicarbonate tablets a day throughout a 12-hour period. Yeah, every 4 hours. And that's just as preventative work. And that's also part of what's in my IV right now, just to keep me doing that. So far, we're doing pretty good. I'm a little skeptical and a little suspicious because nothing has really hit me yet. But in my experience, at least so far with the chemo effects, they don't hit you fast. They creep in and they ebb and flow. So you'll be feeling fine 1 minute, then next it'll slowly come in. Like, you'll slowly start to feel the side effect, and then suddenly it's very noticeable. And on that note, actually, the thing I really wanted to talk about today is some of the side effects that I've been having throughout this whole process. Now, I've gotten a total of 5 different types of chemo. That basically, that would be the, let's see if I can do this, the intrathecal injection, which went into my spine, the doxorubicin, also known as the Red Devil, 2 different administrations of vincristine, one with the other 4, and then one separately last Friday. And then Cytoxin, I believe, was the other one. On top of that, there was also an immunotherapy, which I had a little reaction to. I've already talked about that. Nothing out of the ordinary. It's pretty normal for that to happen, especially on the first. But yeah, so this time the name of the game was methotrexate, and that was a 5-hour administration, which we did yesterday. So we're just kind of waiting to see what happens. Meanwhile, I am drinking so much water and getting pumped full of so much liquid, so as you can guess, the bathroom is my best friend right now. I actually have to measure how much I'm peeing just so that everybody knows, or that we can see if my kidneys are working. It's a very strange feeling. Um, they told me because I've got chemicals in it that I should let them know when I need it dumped and I shouldn't be doing it myself. Haven't been the greatest on that just because I'm trying to hold on to what little autonomy I have. Listen to your care team. This is something where I'm like, I'm doing it, if me and my family, specifically my mom, who is medically trained, don't think it's that big of a deal, I just got to be careful, washing my hands, all of that. Anyway, so side effects. Trying to make sure that this video isn't as big as the first attempt. So the most noticeable one that I have had was migraines, chemo migraines. They are pretty severe. Basically, they slowly creep on for me, and the weird thing is they move. So sometimes it'll be hanging out in my sinuses, and I think it actually affects my sinuses a little because I've had, my ears have been feeling a little clogged from time to time. When I go to speak or chew, I can feel them clicking. If I plug my nose and try to blow out of it, they will sometimes pop. So the migraines are pretty bad, but thankfully after talking to my medical team, we got something that was very helpful for that, so that's been really good. Dizziness also kind of accompanies that to some minor extent. Not as noticeable as the migraines, but definitely a little strange for sure. Or not strange, but definitely they are noticeable. Other than that, there's nausea, which I'm on preemptive anti-nausea medication to help with that. And basically that it's definitely worked for the most part, but I'm also on a steroid, which the fun part of that is the nausea medication causes constipation, which can make you feel a little nauseous on top of the chemo from the nausea, the nausea from the chemo. There's a side effect we're going to get to in a second, or an example of one anyway. So you have the nausea from the chemo, and if the constipation's bad, that doesn't help. But the steroid makes you super hungry, so it's a very weird juxtaposition. Beyond that, the one that I was just pointing out, chemo brain, that's a fun one. Basically, sometimes it's like brain fog. If for those of you who've had COVID or just have tried to function on a day where your brain's just not having it, it's pretty annoying. I've noticed that sometimes my words start to blur together, so I start creating new words when I don't mean to. That could just be Matt. I like to joke that sometimes my brain moves way faster than the rest of my body can. But, I've noticed it a lot more since the chemo happened. There are also some very interesting, less common side effects. But before I get to those, actually, I just remembered one other. Hip pain. Oddly enough, there's a lot of similarities between pregnancy and chemo. So with the nausea, I would be fine 1 minute and then it would hit me immediately. So morning sickness. But then hip pain whenever I try to shift on a couch or on a bed. That one's gone down pretty noticeably, at least. So we're doing okay there. But also there's something called neuropathy, which basically the nerves in your extremities can get tingly. They might be numb. Basically, mine started during my first chemo treatment. Both my right and my left hand and my left foot all went completely numb. They didn't fall asleep per se, but it was definitely very similar to the feeling. Then it moved to my left ring finger and pinky, and it would happen when I would be holding up the phone. And for the last couple of days, it's been hanging out mostly in the tips of all of my fingers. Um, it's a very strange feeling, not a bad one, but maybe a little unpleasant. It's not painful, just weird, and there are moments where I'll just notice it more. Some less common side effects that I've noticed I have. I just recently, yesterday, have noticed that I'm having what's known as visual snow, or at least some form of it, which is basically like if you've ever had a floater where you look over at a light and you see this little kind of translucent thing that's bouncing around, that's a floater. So I'm seeing a lot of those. Now, thankfully, it's not as bad as what my partner supposedly has, where everything looks a little staticky, and that can be very disorienting. So we're not there yet, which that's good. But other than that, my equilibrium got thrown off. So suddenly, I didn't notice it until I went to hang up the phone, and the hang up sound sounded much lower than usual. I even noticed it in everybody's voices. Everything was like down, to use the pitch, it was like half a step down, which was subtle but very strange. Apart from that, there was a little bit of, after the second vincristine injection, there was jaw pain. It felt like I was cutting wisdom teeth or molars, which was very strange because I've already had those removed, or they've cut, in the case of the molars. But yeah, so that was weird. Had a little gum deterioration, and that definitely was a little scary, but we got that taken care of. So yeah, no, it's been an adventure. There's definitely also been some mental health stuff, but I want to go more in depth on that. So we're gonna maybe do a different video for that one. But the weird thing with chemotherapy, I was gonna try to do this in a separate video because it caused the video to be too long last time, but seeing as we're moving a little faster this time, I think we can do it. But the weird song and dance that is chemotherapy is treating yourself with the drugs that you're given, but then trying to get off of those drugs as quickly as you're able to, because the chemo has side effects, but so do those drugs. So you might remember me saying that the anti-nausea medicine caused me to be constipated, and that was definitely a problem. Apart from that, also there was something else it was causing, and I'm not, dang it, chemo brain, why do you always pick at the worst moment to hit me? Okay, we'll come back to it. But yeah, so hiccups. Yes. I've had a couple of those. Thankfully, mine were not intractable, where I was having them for 30 minutes or so. But still, definitely, when you go to take your first bite or first sip of something, that's definitely a little annoying. But that one was a minor thing. But the challenge, again, with chemo and the recovery is trying to get to something where you're doing less prescribed and more homeopathic or holistic healing. Now, just for the record, you do not want to try to treat cancer with only homeopathic curing. It does not, that does not work. I am no doctor. I am not a medical professional. So everything I say, understand this has been my experience. Yours might be, and probably will be, very different. Listen to your care team. They have all of that training for a reason. So definitely don't get swept up in misinformation by any means. But that being said, obviously you want to have an approach for both, or both sides. Really, it's less of you want to let the prescribed medicine do the work for the first part, because it's going to do the heavy lifting. That anti-nausea medicine is great. I've only had 2 heaving moments, and then one very tiny vomit where I just got I was late taking the medicine and eating, and I think that caused it. And I think it kicked in halfway through because after the first part, my body tried to do it again, but it felt like a ball basically bounced up and hit me in the throat, and then bounced back down into my stomach. Not as aggressively, but still, that was a very strange one. So finding alternative medicines, at least for what you can do when you are getting off, is really a key to the battle and feeling better. You want to make sure that you're hydrating constantly, getting up and doing your, in the words of Hank Green, another cancer survivor content creator who definitely, I think his videos are worth watching as well. But as he put it, you got to take your stupid little walks for your stupid little mental health. Which I did one this week, and that felt good. Yesterday I did about 22 laps around the ward, which was a mile and then some equivalent, which was really good. But then also doing things that, taking less aggressive medicine. So for example, one thing I do regularly when I'm recovering is I take Miralax with a glass of juice every morning, along with a hybrid stool softener, mini laxative, and then I try to eat a lot of fiber. However, just because last time it was still a bit of a struggle, we finally got there, but this time we're probably going to have a slightly stronger laxative ready to go, just in case. I love talking to you guys about the gross stuff my body's doing. It's so funny. But yes, so there's that. The other thing that I learned from the first time is trying to make that transition can be really difficult. So I recommend asking about, if you're comfortable with it, medical marijuana, and finding a way where you can get involved, or not involved, get involved, volunteer, but that's not what this video is about. But getting in touch with somebody about that. I went to a place, I believe it was called, it's either Hello Beyond or Beyond Hello. Basically, you set up an appointment time, you pay a fee to get the consultation, and then you'll talk to a doctor, they'll give you the license, and at that point you can go to a medical dispensary where you can talk to a pharmacist and actually find the strain that's right for you. I'm no stranger to taking medical marijuana. I take it recreationally. I like to get a little silly and a little giggly from time to time, but that's not the right one for right now. With that giggly, silly euphoria one, it causes me to be a tiny bit jittery, which is not the greatest thing when you're trying to just deal with the side effects of cancer. So instead, I went to the dispensary and I talked to the pharmacist. And the great thing about going to one with an on-site pharmacist is that you can call them if the effects that you're having are not to your satisfaction, and then you can maybe see about finding something that fits you a little better. But I ended up walking out with 3 different types. They're all calming and zen focused, so really good with treating pain, helping with your appetite, other things like that. The nausea as well. So I'm hoping, I haven't taken them yet, but I'm hoping that they'll really help with the transitional period between the point where I'm very dependent on the medicine to the point where I'm not as dependent and just taking lighter stuff to help with that. Another thing that I recommend is Tylenol and Claritin, the non-D Claritin. The Tylenol is really good for helping with the headaches, at least a little. I will say it's kind of hit or miss. Really taking Tylenol and having lots of hydration. I looked over at my water bottle here with that. They help, but also I found for major headaches, being horizontal helps, hence why you see me lying down in a lot of these videos. But Yeah, so there's that, but the Claritin's really good for the vincristine. You got to take it every day, one every day, because it's got to build up in your body. Um, but also for gum deterioration, um, good oral hygiene, brushing your teeth. Careful with the flossing. I would say water picking is better because it's less abrasive on your gums. I've always had really reactive gums. Could brush, and every time I brushed or went to the dentist, it looked like a horror show. I've gotten a lot better about it. So, thankfully, there was only more blood than usual on the first day, and that's because, like I said, my gums were deteriorating a little. But a good fix with that is the oral hygiene. So that also includes mouthwash and preventative mouth sore wash that you can use because mouth sores are a thing during chemo. Um, but the real one that I think did wonders was warm salt water and or with baking soda mixed in. I gargled that probably twice, and my gums, which part of the deterioration involved them loosening up around the back teeth, it fixed it immediately. There's been no more gum rot or anything like that. So that was really helpful. Yeah, it's all about kind of managing things as much as possible. I mean, if you talk to your doctor and tell them, you don't want to be fully or you don't want to be dependent on the heavy medication as quickly as possible, they're pretty good about making suggestions. I'm just lucky enough that I happen to have a family member who's got the medical experience. But, everybody has their own thing. So, yeah, you know. But that's mostly what I've been experiencing. Again, I said that there is definitely some mental health stuff. That's its whole own video. I may work on that here in a little bit because all I'm doing today is kind of laying around in the hospital. So living that lazy life, yes. But yeah, like so far we're doing okay, and thankfully it seems like the worst, at least of the unknown, is behind me. And now any anxiety that I'm dealing with will be for how is this going to affect me long term? Oh, what if the effects are worse? Things like that. But thankfully, between the daily anxiety pills I'm taking and and then on top of that, I've got some panic attack pills ready to go. Along with the medical marijuana, I think I should be okay. So, just understanding that it's going to change from time to time. I'll be great one minute and not so great the next. That seems to be the best way to get through this. But yeah, so we're doing great. I'm very pleased with how things are going. My node is smaller, so that helps. And we might have some good news. Not anything massive. I'm not about to make a remission or a cured video just yet, so I'm gonna nip that one in the bud, but good steps in progress on the way there. So we're getting there slowly but surely. Slow and steady wins the race, so let's keep going. Stay tuned.